Hello. Hi. How are you?
I'm good.
Very nice to meet you. Welcome. I understand that you are coming from quite a distance.
Mm-hmm.
So where are you from again?
I'm from Oklahoma.
Oklahoma. All right. Well, it's nice to have you. How long are you in town for?
Until Monday.
Monday. All right. Well, I hope you have a great time here.
Thank
And
you.
hopefully this consultation gets you on the right foot to have a great time in LA. And I understand that you're interested in breast augmentation.
Mm-hmm.
Is that correct? Great. So what I'd like to do is get a very good understanding of exactly what kind of result you want, kind of what your dream result would be. So why don't you tell me, what in your own words, what you would love your breast to look like?
I have some pictures. Do pictures good? Like that look?
Okay.
Kind of just like, I don't like them super high up.
Mm-hmm.
Kind of more just like a natural kind of situation.
Mm-hmm.
I really like
That type of look.
Mm-hmm.
Okay, so what I would say, looking at that, just to make sure we're on the same page, is I would say it's not a very big augmentation.
Mm-hmm. Yeah.
It's a very, I would say like moderate.
Mm-hmm.
Yeah, I would just, it's not small, but it's not too big. They're close together.
Mm-hmm.
Right? And so one thing I like to point out is pictures are great. Like the saying goes, pictures worth 1,000 words. So pictures are really valuable, but it's always important to remember how the pictures are taken. So in this particular case, she's wearing a bikini.
Right.
And bikinis in general tend to push the breast a little closer together. So keep in mind that in clothing, you're going to be able to make the breast look like almost anything you want.
Right.
Okay? But surgically, what I'm going to talk about today is how you're going to look without clothing.
Okay.
And then keep in mind that with bikinis, with tops, with bras, you can make them higher, bigger, closer, all of that. Okay. But I do notice that the breasts are coming together a little closely, which is something a lot of patients like.
Yeah.
Okay. You have any other examples?
I have one picture of yours actually that I like, but
Great.
I think these might be just a little on, because I don't want to go too big just because I am on the petite side and I still want, like I don't want them to make me appear larger, if that makes sense.
Sure. Yeah, because the example you showed me, she was also a petite girl, and I think it was a very tasteful size.
Okay.
That would not make her look like she was a big person.
Like I like those, but that might be too, maybe still like just a touch too big.
Okay.
Maybe.
Let me see. Okay. Good. Yeah.
Yeah.
All right. We'll look at options.
Okay.
Great.
Yeah.
Because one of the things I often explain as well is that bra sizes are very unpredictable, very inconsistent.
Yeah.
It's so funny how many women, when I ask them the bra size, they really don't know sometimes. Yeah. It's a testimony to how unreliable and inconsistent bras are because it depends on the brand. It depends on the number. It depends on the style.
Absolutely.
But for most brands, maybe you're like a 32B.
Yeah,
okay.
I'd say.
So then, moving forward, if you had to guess what cup size you would want to be, what would you say what that would be?
I would say maybe like just like a very full B or like a very small C.
Okay.
Maybe.
Okay. I think the pictures you showed me are consistent with that.
Okay.
Those were all, I would agree that they probably, that one picture in particular did look like a small C maybe on.
Okay.
Okay, great. So you'd be happy with something around that size. That gives me everything I needed to know.
Awesome.
Now, let's switch gears.
Okay.
Do you have any medical problems at all?
Nothing.
All right. Do you take any medications of any kind?
I take that's it.
Very common. Perfect. Do you have any allergies to medications? Have you ever had any other surgeries?
No. Just like wisdom teeth.
Wisdom teeth, okay. Do you smoke?
No.
Do you vape?
No.
I love it. This is my ideal kind of patient. Super easy, straightforward. Great. So that's everything I needed to know. So what we're going to do next is I'm going to step out.
Okay.
I'll have you change into that black gown. Put the open part in the front.
Okay.
I only need to see the chest. Everything else can stay on. And then when I come back with my nurse, we're going to take some measurements and then pictures and go from there.
Okay.
Great.
Thank you.
And this is our amazing nurse, Christina.
Okay.
Very nice foundation.
Okay.
You have a nice shape to the breast. Great overall. Yeah. You're gonna look great no matter which implant we pick.
Okay.
Now, like every human being in the world, there are some little asymmetries.
Right.
Totally normal.
Yeah.
Every woman has one breast that's a little bit higher than the other. One breast is a little bit bigger than the other. And when we do the surgery, there are ways that we compensate for that and make you as symmetric as possible. Okay. All right. So let's go through here. So from that point, your left nipple is 19.5 centimeters. And then on this side, it's 20. So a tiny difference there, totally normal. From the left nipple to the bottom of the breast here is 6 centimeters. And on this side, it is 6.5. So the right breast overall looks a little bit bigger.
Yeah.
And these are things you might have noticed already. Yeah, totally normal. Then the areola is about 32 millimeters or so. And the left is the same. And then the most important measurement I take is something called the base diameter. And what we are measuring is the width of the breast, because that determines which implants are going to fit and be proportional to your frame. Okay? So a lot of information from this one measurement. And your measurement, your base diameter, call it 11.3. And 11.3 is a petite number, which makes sense because you're petite.
Perfect.
Okay, so for someone your height, your weight, your frame, 11.3 is a perfectly appropriate number. Okay, great. Now that we have all of your measurements, the next step is to take some pictures. And you might have seen this on my social media or my videos, but it's a 3D camera. Yeah. It's my favorite toy.
It's very cool.
It's amazing. It's amazing. In my opinion, if you don't have this in your consultation, then the consultation is not complete. Because it's so incredibly valuable for you and for the surgeon. The value of the 3D imaging as a patient is that it removes the anxiety that everyone often feels before surgery, which is, what am I going to look like?
Right.
So you're going to see it in real time, and then you're able to select which implant you feel is best for you. Okay. And then obviously I'm going to be here to guide you, but when patients pick implants this way, they're super happy. Okay. Super happy. So we're going to take 3 pictures. Okay. Perfect. Okay, so that's the first picture. We're taking 2 more. You can relax the arms. Perfect. All right, we have all your pictures. You can put your gown back on. Fantastic. So really, I meant what I said. You have a great foundation. Okay. So with your anatomy and your shape, any implant we put in you is going to look great. Okay. That's this is a win-win situation. Perfect. You can't go wrong.
I'd love to hear it.
Yeah. Okay. And based on what you told me, I think I'm already coming up with a great plan. Okay. All right. So I'm going to start the software. Now the computer takes its own measurements, and just like we discussed, there are some slight differences which you already knew. And so as my measurement showed, this nipple's a little bit lower than this one. The distances from the center are going to be different because this breast is overall smaller. Right. Now, what's amazing is with this technology, every woman, by the way, has one breast that's smaller than the other. Always. And a lot of women, the difference is so small we can ignore it. But in a lot of women, it's enough. It's significant enough that we do have to compensate for it. But with this technology, the computer gives me the exact number. Okay. And this is interesting. So even though it's visually smaller, your rib cage is more prominent on that side. Huh. You see that? Yeah. Have you ever noticed that the rib cage is more prominent? Yeah. So there, you see this? So it ends up evening the projection out. Okay. So that's why I love this technology. Yeah. Because visually, if you just see this, you think like, oh, we have to put a much bigger implant on that side. But no. Okay. And in fact, because the rib cage is pushing out, we could probably use a very similar size implant and get you really good symmetry. Okay. But without this technology, it'd be easy to miss that. So that's great. So see, you can see from this view that the rib cage is more prominent, but the breast itself is very similar. Okay. Okay, good. So that's great. Perfect. Makes it even easier. Now that we've gone through the measurements, the next step is to talk about implants. Okay. So there's only about 5,000 options. Perfect. That's it. I'm gonna walk you through all the options in a way that's very easy to understand. Okay. Okay. So all of these implants here are silicone, except for this one. This is the shell of a saline implant. Okay. And as you can see, these implants come empty, and then we fill it in the operating room with salt water. But if you hold it, you can tell that even when it's filled with salt water, it's not going to be as soft as silicone. Right. So silicone is definitely softer and more natural feeling. Okay. Okay? Gotcha. So that's why everyone today uses silicone. Okay. So I would recommend silicone. All right. Now, when it comes to silicone implants, they come in 4 basic shapes. This is low, moderate, high, otherwise known as full, and then extra high. Now, different companies call them different things. So some implant companies call the moderate plus. Some call the high full. And so, but they're all basically the same. It's these 4 basic shapes. And the reason there are different shapes is so that we can tailor the result to each individual depending on what they want. Okay. So let me go through the options for you and kind of summarize them. So let's start here with the low. So the low profile implant does what it sounds like. It really creates very little projection. Gotcha. It's a pretty flat implant. And when it goes in the breast, it basically just takes your breast and pushes it out slightly. Okay. Not a very popular implant. Right. Not a lot of women, would be happy because they want some enhancement. Right. And this is maybe a little too conservative. Okay. So I think we can ignore that one for a second. Now let's skip these 2 for a second and let's talk about this one. This is the exact opposite. Yes. So this is the extra high. Okay. So very round breast, tends to create a lot of projection, a lot of fullness, more of an obvious type of augmentation for most patients. And most patients don't want this either.
Yeah.
Because most patients say, I want to be bigger, I just don't want to be that big.
Right.
And you're telling me you want to be a small C, right? So this probably is not the implant for you. Okay. So that leaves us these two, moderate, and let's call this the full.
Okay.
Both are great options. Let me show you the moderate. The moderate, in my opinion, is the implant that is best designed to create the most natural look, because it has a very nice teardrop shape.
Yeah.
So you see when you're standing, thinner at the top, and it has this really nice gradual fullness to the bottom, and it has very gentle transitions.
Yeah.
So this creates beautiful natural looking results. For someone like you, it's spectacular.
Okay.
And given the pictures you showed me, this 100% will give you that look.
Okay.
The full or high profile is also an excellent choice. But in general, this implant also assumes a teardrop shape. Okay. But you can see how much more projection it has.
Right.
This tends to create bigger cup sizes.
Okay.
So still natural, but just much bigger, fuller breasts.
Gotcha.
So if someone comes and tells me they want to be a full C or a D, usually the high profile is a great choice.
Okay.
If someone tells me they want to be a full B or C, the moderate tends to be a better choice. So given everything you've told me, I think you would like the moderate. Does that make sense?
Yes.
Okay.
I agree.
Okay. Perfect. All right. Now that we know you want the moderate profile implant, what I do is I tell the computer we're looking at the moderate profile implant, and it gives me a list of all of the implants and all of the measurements.
Okay.
And so we've narrowed down 5,000 options to about 50.
Perfect.
Okay. So we're almost there. So the last step is actually the easiest, because it's just a matter of matching the implant's measurements to your measurements.
Okay.
That's what guarantees it will be proportional.
Okay.
So when I measured you, there were a bunch of measurements I took, but I said the most important one was that base width.
Okay.
That's how much space you have inside the breast. So the implant has to be able to fit in there.
Okay.
And your measurement was 11.3. So that means any implant we use should be 11.3 or less.
Okay.
If it is, it's going to fit in perfectly into your breast tissues, and it's going to be very proportional to your frame. So if you look here, the computer highlighted this region.
Okay.
And if you notice, look at the measurement of the fullest one it's offering you. 11.25.
Okay.
You're 11.3. That's a perfect match.
Wow. Okay.
You get it? Okay. So what that tells us is that's the implant that is best going to fit your breast the best way, be the most natural, the most proportional.
Okay.
That contains 255 cc's.
Okay.
Which is on a smaller, like if you look at implants, that's on the more conservative side.
Yeah.
But that's the type of look you're going for. Number one. Number two, you're starting out with some breast tissue.
Yeah.
You're not flat. If someone's flat chested, if someone has very little breast tissue, they need a bigger implant to create the same look.
Okay.
If someone has breast tissue, they need a smaller implant to create the same look. I mean, there's a lot of science to this, but there's also some art. And the art is figuring out what is the nice balance between size and shape and all that. Okay.
Gotcha.
So now, what I'm going to do is tell the computer to show it to us. Okay. It's going to give me a simulation, and then I'm going to tweak it.
Okay.
And what I'm doing when I tweak it is I want to recreate the same steps I'm going to do in surgery to give you the best shape and symmetry. And then during surgery, I always design the pocket to be as close together as possible.
Okay.
So we want to...
Yeah, because that's my other thing. Is there a way so that they don't sit so far apart, or is that like an anatomy thing?
It's mostly the individual's anatomy.
Okay.
By the way, the number one thing most patients ask me is there a way to make the breasts closer together? It's probably the most common question I get. And the answer is yes.
Okay.
Your breasts will be closer together, but there's a limit.
Right.
It has to do with the position of the muscle.
Okay.
And the reason women have different gaps between their breasts has to do with where their breast tissues and muscles are attaching to the rib cage.
Okay.
So some people, they're born and their gap is this wide. That's where their muscles attach.
Okay.
As we're going to discuss, we want to put the implant under the muscle. So if the muscle's here, we really can't detach the muscle and reattach it. So it kind of is a physical limit to how much we can move the implant, okay? But I always try to make it as close as possible.
Okay.
And the best way I describe it is, if you start out with a gap this wide, I'm going to make the gap this big.
Right.
So we're going to make it smaller. If the gap is this big, I'll make it this big.
Okay.
If it's this big, I'll make it this big. It will always be smaller, but it really depends on your measurements, on your attachments, and your muscle. Okay. But you want to hear the best news? Your measurement is perfectly fine. Your gap is fine. You don't have a big gap. It's just everyone wishes it was smaller. So I want to make it as realistic as possible.
Okay.
It's a computer.
Right.
But it's the closest we can get to show you what you're going to look like without actually doing the surgery.
Okay.
The only way I can get closer is if I wake you up in the middle of surgery and say, is this okay? Do you like this? We probably don't want to do that. So we have to decide in advance. So here's the before and after.
Okay. And how many cc's would that be again?
255.
Okay. So there's this person that I follow that has 255 cc's, and I think hers look really big.
Ah, interesting. Now, a couple of things I always tell everyone, because this comes up a lot. So I have a lot of patients who'll say, well, my friend got, I want 365 because my friend got 365. Right. What's important to understand is that the implants are going to look completely different depending on your measurements.
Okay.
So, for example, this person that you referenced that has 255, you think they look big. Any idea what her height is compared to yours?
I think she is taller than I am.
Okay. And how much breast tissue does she start out with?
That I don't know.
Right. So back to...
Can I show you a picture of them?
You want to show me? Sure, sure.
Because I haven't screenshotted it and I think they look great. But for me, I think are maybe a little big.
Yeah. This is the tough thing because I'm looking at a person's picture. Right. I have no idea their height, their weight. I don't know what their measurements are. I don't know how much breast tissue they started out with. So that's hard for me to comment on. Having said that, this is why I love the simulation. Because at the end of the day, regardless of what anyone else looks like with 255, the only thing that matters is what you look like with 255. Yeah. So now I'm going to put you in the hot seat. I've been talking a lot. I'm talking. But here's the question. Looking at this image, what do you think? Do you think it's too big?
It's at first it's shocking a little bit. I don't know. I can't decide.
Well, this is why we have this simulation, because we can create other ones. Okay. So let me save this one.
Okay.
By the way, do you know what the number one thing is women will say after surgery?
I think they went bigger.
And I can promise you that this is not too big.
Okay.
Because why? You see there's 4 different shapes. You're choosing the one toward the more conservative side. Yeah. So the moderate is very conservative, very narrow. Number 1. Number 2, we're picking an implant based specifically on your measurements. So it's tailor-made for your dimensions. So by definition, it's going to be proportional. So I can assure you, no one would think this is too big. Anyone looking at you would not think it's too big. Now, having said that, my goal is to make you happy. Okay, so we're going to look at other options. One option is we can go down a shape. So there's moderate. So you looked at the moderate. They have something called a low plus. So it's one, so that you see the low and the moderate, there's one in between that. So it's less full. Yeah. It has less projection.
I definitely think I want more fullness, I think is my problem.
Yeah, of course.
So I feel like I agree with you on the moderate.
Okay, so you want to stay with the moderate.
Yeah.
Okay, great.
Because I feel like kind of up here is where I want.
Great. Okay, great. So this is perfect because this is how we figure out the perfect implant for each individual, because it's not cookie cutter. Yeah. It's very personalized. So after thinking about it, you want to stay with the same shape. So maybe now it's just a matter of the size. The CCs.
Yeah.
Perfect. As I mentioned earlier, I use the word range. And what that means is there's no one perfect implant. There are many implants that would all look great on your body. What the computer is telling you, what I'm also reassuring and reinforcing, is the fact that of the range, the 255 is the fullest one recommended. But any one of these will also look fantastic. Right? So you see this highlighted range? These are all the implants that are within your measurement. So any one of these will look great. Now the smallest implant they make is 140. That's tiny. That's like a baby. That's like a little baby implant, all right? Most people don't want to use something that small. Perfect. We looked at 255. Now I want to show you something. Here's 255. Here's 240. That's a 15 cc difference. There's nothing in between. The reason there's nothing in between that is because the implant companies don't bother making implants that vary less than that, because you can't even see the difference. So if I show you 240, it'll be useless. It'll look exactly like the 250. 255. So here's 210. So maybe we look at the 210. Now keep in mind, the smaller the implant, the smaller it is in every direction. So the smaller it is this way, the smaller it is this way, but the smaller it is this way. So the gap
is going to be bigger.
Right, exactly. Okay. So something to keep in mind.
And so you would probably do the same size in both.
I think so, but here's the great thing. Because I have this technology, because I know that there could be potentially a size difference, I'll have the other implants ready to go.
Okay.
So I walk in the operating room, I'm already prepared.
Okay.
You know, I can't tell you how many times, because I do a lot of revisions. So I do a lot of cases where patients aren't happy from other surgeries. I can't tell you how many times I have patients come to me and tell me they're unhappy with the size of the implants, and it's because in surgery, the size that the surgeon had picked for them didn't work. They didn't have any other options because they weren't prepared. Okay. And then the surgeon had to use implants that probably were not the right match. Okay. That happens. Gotcha. Okay, but with this, that won't happen with you. Because I go in, I already know exactly I know all your measurements. I know where the differences are. I know what rib cage is more prominent than the other. And I know which implant options I have to have ready. 210. That's a very conservative implant. Okay. That looks great too.
I kind of like that.
Yeah. I mean, that's why I said you're easy, because any implant we put in you is going to look great. So now let's see all threes. So here's 210, and then here's 255.
Can you turn it to the side? Yeah.
So the 255 will definitely have more fullness up here. Okay. And then you see the 210, it's going to be more like a slope.
I think I like the 210.
Okay. I think that's a great choice. So between these two, you prefer the 210?
I think so.
Okay, good. So let me ask you the next question. Do you think you'd want to be any smaller than the 210?
No.
Good. I agree. Okay. I think if you went smaller, you would probably regret it. Okay. I think 210 is a great, let's call it the floor. Okay, and then we know the ceiling is 255. Okay. So the only option in between is 240. Yeah. And 240 would be right in between that. Okay. So it's such a negligible kind of difference. Do you want me to show it? Just to have it?
Just to have
it. Yeah, I mean, you came all the way from Oklahoma. I gotta I gotta make it worth it for you. Okay, so let me show you the 240. And you're gonna see it's a minimal difference. Okay. And it's great because I always tell patients, as long as we narrow it down during the consultation to 2 to 3 options, you're great. Because nothing is set in stone.
Perfect.
Nothing we decide today is set in stone. You can always change your mind. Okay. But as long as you have 2 to 3 options, you're in a great place. Okay. What you don't want to do is walk out of here with 10 options. Okay, perfect. Then you're gonna be stressed out. Yeah. All these sizes we're looking at, these are beautiful sizes for you. Okay, I think we got it. Okay, so let me show you all 3. Okay. 210. 240, 255.
Yeah, so I think 255 is too big.
Okay, good. Yeah. All right.
I think I like 210.
Okay, I think that's great. Perfect. Now, do you want to take some pictures? Yeah. Let's do that. All right, awesome. Okay. We have 3 great options, but it sounds like you're leaning toward the lower 2.
I think, the lower 2 for sure.
Beautiful. That's a great place to be. Fantastic. Okay, now that we've narrowed it down to these great options for you, let's talk about the surgery and the recovery. Okay. I have my own accredited operating room and recovery room. Okay. And I have my own team that works with me full time. And they're an amazing team. They take excellent care of you. You're a young, healthy woman. You don't have any medical problems, no medical issues. So this could not be easier. Okay. The whole surgery takes about an hour. Okay. Once you're asleep, the first thing I do is make the incision. And the incision should be made in the breast crease. That's been proven to be the safest way to insert the implant. It protects you from capsular contracture. Do you know what that is? Have you heard about this?
I've heard of it. Yeah. I don't know exactly what it is, but
Perfect. No, it's good. Okay. I'm happy because we should talk about it. Okay. So capsular contracture is a complication in which the scar tissue around the implant gets hard, squeezes the implant, and then it distorts the shape. It's nothing dangerous, nothing bad is going to happen to you, but cosmetically it's very unappealing. Okay. We know that if you insert the implant through the nipple, the risk of that complication happening goes up very high, significantly. Okay. If we put it through the crease at the bottom of the breast, the risk drops dramatically. Okay. So that's one benefit. The other benefit is if you go under the breast, you go under all the structures of the breast breast glands, the milk ducts, the nerves. And so your chances of breastfeeding in the future are better. Okay. Also, sensitivity, sensation of the nipple. If you go through the nipple, you're going to cut the nerves that go to the nipple. If you go under, you're more likely as a surgeon to preserve those nerves. And so the sensation is more likely to be intact. Okay. So for a lot of reasons, it's a much better scar. Plus, in my opinion, and I think most people would agree, it's a better looking scar. because it's going to be hidden under the breast crease.
Mm-hmm.
You're never going to see it nude.
Yeah.
You're never going to see it in clothing. You literally would have to raise your breast. And then when it's healed, it just looks like a wrinkle in the skin, which every woman has a little wrinkle.
Yeah.
Whereas the scar around the areola, scars never disappear. They just fade. So you will always have a line around the areola that will always be visible whenever you take your top off. There's going to be a line. And so I think it makes more sense to have a line where you can't see it than a line where you can see it. Okay. Any questions about that? No. Okay. So once I make the incision, then I dissect the pocket under the muscle, and we place the implant under the muscle. And same idea. Placing it under the muscle has been shown to be the safest position for the implant.
Okay.
Any questions about that?
How does that, I do Pilates, how does that affect working out, I guess?
So here in Southern California, all of our patients are very active, very physically fit. Every single one of my patients gets back to the gym and does everything they were doing before surgery. Okay. Now, having said that, there's a little bit of a recovery process, right? So initially, first couple of weeks, I don't want you doing any exercises, and definitely not with your upper body.
Okay.
We want everything to heal, but once you're healed and once you're recovered, then you can do any exercises you want. And it should not impact your ability to exercise. Okay.
And my other question for recovery and healing, so I'm a hairstylist, so I do like a lot of upper body movements, I guess.
Yes.
How would that look for like recovery and?
Great question. So we've had a lot of patients who are hairstylists, makeup artists, and you work a lot with your arms.
Yeah.
So my advice is definitely you don't want to work the first week.
Okay.
Because you're going to be a little sore.
Right.
And when you go back, I want you to go back to work and feel the best that you can and do the best work you can. So what I tell people is obviously you have to balance real life obligations with, recovery. A week is too little.
Yeah.
2 weeks would probably be really good.
That's kind of what I was looking at.
Yeah. Most of my patients who go back after 2 weeks tell me that they're fine.
Okay.
And then if you wanted to be extra cautious, maybe if there's a way that you can, when you go back, maybe you make your schedule a little lighter.
Okay.
That would be like icing on the cake.
Okay.
Okay? But that should be a reasonable.
Okay. Yeah, that's kind of what I was assuming.
Okay. So I make the pocket into the muscle. Then I put a sizer. Have you ever seen any of the videos I've done for surgery? You have? Okay, great. So then I use a sizer.
Okay.
And what I'm doing is I'm testing the size.
Okay.
And I want to see, what does it look like? Is it the right shape? Then I compare it to the other side and I see if I have to make any modifications.
Okay.
If we need to make the implant a little smaller on the other side to match it. So all of that is done with the sizers. We want to open your actual implant last.
Okay.
Okay. So once everything's been confirmed with the sizers, then I open the actual implant. And then I insert the implant using a no-touch technique where I wash the skin with antibiotic solution, and then I insert the implant using a funnel. All of that is designed to reduce all the risks and complications. Then the implants go in, and I sit you up again, and I look at you again from every angle and confirm that it looks perfect. And once that's done, then I close the incision.
Okay.
And I know how important the scars are.
Yeah.
So I really take my time. And I close everything in layers. I bring the skin together really beautifully. I want that scar to look perfect. And I cover with surgical tapes. And I place you in a bra. Then we wake you up from the anesthesia. And then you recover here for about an hour. Okay. Once you're awake and you're alert, then someone has to come here to pick you up and take you home. Since you're out of town, we have a lot of patients from out of town. Everyone does different things. Some people, they have friends or family in town. Some people get an Airbnb. Yeah. So any of those options are great. Okay. But my advice is to try to stay local. Yeah. So you're close by in case you need me or I need to see you. It's easy. And then you should have a responsible adult with you. Yeah. So someone that can watch you, especially the first night. Okay. So let me walk you through the recovery. Okay. Here's the best part. Every single patient that I ever operate on, when they come back a week later and I ask them what the recovery was like, everyone always says the same thing. They always say, it wasn't as bad as I thought. So I think the fear of the recovery is usually worse than the actual recovery. Right. But here's what you should expect. The first 2 to 3 days, plan on doing nothing but resting. Okay. So that doesn't mean sitting in bed like a slug. It means resting, sitting on the couch or in the chair, watching TV, on your computer, on your phone, hanging out with your friend, family member, loved one, whatever, and just taking it easy. Okay. But it's not like you're going to be able to walk around, move, but you just want to rest. You want to rest your body. If you do that, you're going to have a great recovery because you're going to give your body the time it needs to heal itself. Okay. Now, you will have some pain and pressure. That's inevitable. You had surgery. So it kind of comes with the territory, but it's very manageable.
Okay.
We'll give you pain pills in case you need it. Most people do take them. The key is to take it when the pain starts.
Okay.
So let's say you start feeling a little bit of pain, you take a pain pill, pain will subside. And then maybe 4 to 6 hours later, it might start again, you take another pain pill, and then it'll subside again.
Okay.
And that's how you're going to control it. Then what happens is by like the second or the third day, you're going to wake up and feel significantly better.
Okay.
Because you gave your body the time it needed to heal. And then a lot of people tell me that by the third day, they wake up and they feel like, wow, oh my God, like it's so much easier for me to move. I don't feel so much pain. I don't have to take a pain pill right away. So people start taking less pain pills usually by the third day.
Okay.
And if you're getting a little bored inside your hotel or Airbnb, the third day is when you can start getting out.
Okay.
Let's say, you want to go for a walk or you want to go to get something to eat. Totally fine.
Okay.
As long as you're not driving and you're not lifting or pushing anything heavy.
Okay, gotcha.
And then each day that goes by, you're going to feel stronger and better, and you're going to be moving around easier. And then most people feel great after about 4 to 5 days.
Okay.
To put it in perspective, my patients who have desk jobs, let's say an office job where they're like just sitting at a computer, they're back to work in 4 or 5 days.
Okay.
People that work remotely, they can start immediately almost. Now, again, your job is a little different. So we talked about you taking a little more time off, but you'll feel very good to do most normal things after about 4 or 5 days.
Okay.
Then you come back and see me a week later, more or less. Then I check on you. I make sure you're healing well.
Okay.
And then as long as everything looks good, at that point, you can go back home. Traveling is fine.
Yeah.
Planes are fine.
Okay.
There's no issue with the air pressure. That's a question a lot of people ask. Then when you get back home, you can resume all of your normal day-to-day things. So what does that mean? Running errands, doing chores, making a meal, tidying up around the house, going out with friends, dinner, lunch, totally fine.
Okay.
Exercise, we have to modify.
Okay.
So it's not like you can't do anything. You just have to do very light things.
Okay.
So walking is okay. If you want to go for a gentle hike, that's okay. Some people have a bike. You can sit on the bike and pedal.
Okay.
But no soul cycle classes where you're like going up and down.
Okay.
No weights, no Pilates or yoga with the upper body.
Okay.
But then each week that goes by, you're going to feel stronger and better and more like your normal self.
Yeah.
And then usually after about 3 to 4 weeks, people are returning back to their normal routine. And then after a month, we're going to do another follow-up.
Okay.
Since you're out of town, we'll do it virtually.
Okay.
So what we do in those cases is you'll send me pictures. I'll look at the pictures. We'll talk on the phone and we'll confirm everything is going great.
Perfect.
And then at that point, there are no restrictions.
Okay.
Then you can go back to everything you were doing before surgery.
Okay. Perfect.
That's it. Any other questions?
I don't think so.
I think we covered it
I
all.
think we covered it all.
Yeah. All right. Great.
Yeah.
Well, it was fantastic meeting
Thank
you.
you so much.
I think we have a great plan.
Okay. Perfect.
You're going to be very happy with those choices.
I'm excited.
You can't
I
go
feel
wrong.
good.
Okay.
Thank
Excellent.
you so much.